Hey, Kevin, you're our unofficial whip for us. Tell us what happened over the weekend in terms of negotiations and, back-channel talking and changes of allegiance when it comes to this vote.
Hey, Vonnie, hope you had a good weekend. Look, it has been a tough sell for Senate Majority Leader Mitch McConnell as he tries to get his caucus all on board. But he's facing two major groups of defections, so to speak. You've got the conservatives, of course, led by Senator Rand Paul, Senator Ron Johnson, Ted Cruz, Mike Lee. They're saying this bill is not conservative enough. Then you have moderates like Senator Lisa Murkowski, Senator Susan Collins, and Senator Dean Heller, who say that this is a bit too conservative. They don't like several of the issues and the cuts to some entitlement programs a part of this piece of legislation. Now, Bloomberg, a fresh story on the terminal, reporting that there could be a revised version of this bill as early as today, but it's very, very unclear whether or not the majority leader is going to work to appease conservatives or moderates. But here's what I can tell you. The Nonpartisan Congressional Budget Office is expected to release a scoring of this piece of legislation as early as today. And we saw a similar jockeying go along in the House of Representatives when they had released several versions of the bill. So it really could mean that the CBO could score one version of a bill, but the bill that ultimately gets voted on, if the leader gets his way by the end of this week, could end up being different.
Will the CBO analysis, Kevin, give McConnell some wiggle room to woo some holdout senators or not?
That's a great question, and I think if you're Senator Dean Heller, a Republican from Nevada who's up for re-election in 2018, this CBO score, a lot of emphasis is going to be placed on it because no matter how you crunch the numbers, the most important number that Republicans in states like Nevada, like Senator Heller, are going to be looking at is how many Americans would lose health insurance, because this really does have the ability, this particular policy issue, to reframe the 2018 midterm elections.